Okay, so the last thing we're going to talk about is some conditions to do with, well, first one's asthma and doing cardio exercise based around an asthmatic. So when you're an asthmatic, it's a narrowing of the airways, usually due to inflammation, but it can be related to other things as well. But asthma itself is usually like a wheezing condition that affects the lungs and the bronchial tubes. So with that, there's a lot of preventative measures that asthmatics can use, one of them being the old Ventolin spray. So they use that as a way of preventing, and also if you do have an attack, to stop the actual attack from continuing the symptoms. So always have that on hand. Also get them to speak to their doctor first before undertaking any exercise. Cardio exercise being one of them, they can do a normal exercise regime, not similar to anyone else in the community, but they should just manage it through their doctor if they've had any issues, if they've gone to the hospital recently for an asthmatic attack. So find out what their triggers are. Sometimes it can be pollen, it can be change in air temperature, or it could be actually exercise that causes an attack. So therefore you may have to use the Ventolin spray or another form of medication to prevent it happening first prior to the exercise. So that's a very important thing. Cardio is a great thing for them, helps with the lungs and everything else in the respiratory and circulatory system. So it's beneficial to all populations within the human race that have any kind of conditions. So it can be beneficial. So it's still important to do it. They can still do a normal exercise regime as long as they do their preventative measures first, or they manage it correctly. But always keep an eye out for those symptoms of wheezing, shortness of breath, even that blueness around the lips. The next one I want to talk about is hypertension and doing strength training around with it. So hypertension is high blood pressure. Can be can be a risk factor, higher risk factor for stroke and heart attack. So it's very important that if their blood pressure is too high, they need to go see a doctor first. Therefore, if it's way too high, or the doctor, I'll be getting a clearance first anyway, medically. So get a medical clearance if they're at that higher end of the blood pressure, and then get them to bring that to you, and that'll say what they're allowed to do and what they're not allowed to do. With that higher level of risk factor for heart attack and stroke and the likes, exercise can be an issue. So build up slowly to it if they're not used to it. So what that means is start them off slow, then build up to it to a level that's functionable as a way of building fitness. So and strength. With a strength regime, start off lighter weights, get them used to it. I wouldn't be doing anything along the lines of trying to get the heart rate up or anything like that until they're at that level. If they're already at that level and undertaking medication, the doctor says it's fine, then it's fine for them to train normally. Very good, exercise very good for high blood pressure because it actually helps to reduce it and has a lot of beneficial factors to it. So strength exercises are great as long as they're healthy, as long as the doctor gives them the clearance, and as long as it's not too high. If it's too high, just a lighter version first and build up to it. So the last one I want to talk about is arthritis, a painful condition of the joints. Can be caused from a genetically based thing, so that can be in relation to an inflammation in the hand joints, or it could be in the legs, it could be any joint of the body. So it can be all of them or some of them. So you've got to modify the training, any form of resistance training, around what they can and can't do. So it's very important for them to keep moving, keep those joints going. So resistance training is a good form of exercise for them, as long as it's light and not pushing the pain threshold beyond where they need it to be. So very, very important is that they, are not in too much pain more than anything else. It can't hurt them to exercise, and exercise is actually very beneficial. So resistance training itself keeps those joints moving. Good compound ones are great, but on that lighter end, and as much as their pain threshold can hold. So there are forms of medication that they do take to help with reducing that inflammation and to stop pain Just make sure that they're on top of it, make sure they're comfortable, and modify your routine based around their pain threshold. All right, thank you.